Many older men face a silence that weighs more than any treatment. They often confess to me with a mix of embarrassment and resignation that they do not dare to ask about their sexual life, and they tell me almost in whispers, "What is the name of that erection cream, and does it really work?" These questions reflect a reality that many men do not express: the worry about maintaining their virility and their intimate well-being. It is not unusual to find men who avoid talking about the subject even with their partners or with friends, and this reluctance, although understandable, can create anxiety, fear of failure, and a feeling of isolation. Recent studies show that approximately 1 out of every 3 men over 50 experiences some degree of erectile dysfunction. This statistic does not aim to alarm, but to normalize a natural phenomenon of aging. Most of these men feel they have lost some of their sexual confidence, but few know that there are effective, safe options supported by modern geriatric medicine. It is not only about improving the erection, but about regaining autonomy, security, and the ability to enjoy intimacy with a partner without fear or guilt. If you have tried solutions on your own or followed internet advice without results, this content is especially relevant for you. Here we will explore not only the erection cream known as Alprostadil, but also how to integrate it into your life in a conscious, practical, and safe way. We are going to debunk myths, clarify doubts, and offer real strategies that you can put into practice today. I also want to invite you to participate actively. Share your comments, your experience, or any questions you may have, because many times other men benefit from hearing stories similar to yours. This video is not just medical information. It is a space to normalize the conversation about male sexual health in adulthood. Every detail you will learn here, from the correct use of Alprostadil to the emotional and environmental preparation, is designed so that you recover confidence, vitality, and the joy of living your sexuality fully. Today, we are not going to promise magical solutions or immediate results, but concrete and understandable tools that, if used responsibly, can transform your intimate experience. Alprostadil is a medication available as a cream or gel that is applied directly to the penis, specifically in the urethra. Its main objective is to improve blood circulation in the intimate area, making the appearance of an erection more natural. Many men confuse it with a magic solution, but it is important to understand that it works as a tool that enhances physical processes that already exist in the body. It does not act by itself. It requires conscious and correct use to achieve effective results. To understand how it works, you can imagine a fertilizer applied to a plant. The fertilizer does not make the plant grow out of nothing, but if the soil is prepared and the plant has the necessary conditions, the fertilizer accelerates its development and strengthens its roots. In the same way, Alprostadil improves local blood circulation, increasing the arrival of blood to the erectile tissue, but it will only give the best result if the body and the mind are prepared. This detail is essential because many men apply the cream in a rushed way or without considering the context, and then believe that the product does not work, when in reality the problem is in the application or in the lack of preparation. Unlike oral treatments such as Viagra or Cialis, Alprostadil works locally and does not affect the digestive system or the heart in a general way. This makes it an interesting alternative for men who take daily medication for blood pressure, anticoagulants, or who have heart issues. And since it does not travel through the whole body, the risk of generalized side effects is much lower. Even so, it is essential to follow medical instructions to avoid discomfort or irritation. Another important detail is that Alprostadil needs a moment of application and a waiting time before reaching its maximum effect. It is not about applying the cream and expecting an immediate erection. The effect appears within minutes, but the combination of physical preparation, mental relaxation, and stimulation is what determines success. For this reason, knowing how and when to apply it is key to making the most of its potential and living intimacy with confidence and security. Alprostadil is especially useful for men with mild or moderate erectile dysfunction, and its effectiveness has been documented in many clinical studies that include patients over 50. Not all older men experience symptoms with the same intensity, nor do they respond to treatments in the same way, so individualized medical evaluation is essential. Some men experience occasional erection difficulties that only appear under certain conditions, while others live with a constant difficulty that affects their confidence and intimacy more significantly. To understand better who benefits from Alprostadil, we can imagine different situations. A 55-year-old man who has recently noticed that his erections are not as firm as before may find in the cream a quick and localized solution that helps him regain control of his sexual encounters without depending on systemic treatments. Meanwhile, a 70-year-old man who has lived with erectile dysfunction for several years may find in Alprostadil a complementary tool that, combined with pelvic floor exercises or hormonal adjustments, allows him to maintain an active and satisfying sexual life. Clinical experience shows that age itself is not a limiting factor. What truly determines treatment success is the combination of physical condition, emotional state, and adherence to medical guidelines. Many older patients feel relieved knowing they do not need to depend only on oral pills that could interact with other medications. For men with hypertension, diabetes, or cardiovascular treatments, the local application of Alprostadil offers an additional benefit since it works directly where it is needed, reducing risks and general side effects. It is also important to highlight that the response to Alprostadil can vary depending on the frequency of use and the body's familiarity with the treatment. Some men require an initial adaptation phase in which they practice alone or in low-stress moments to observe how their body responds. This helps reduce anxiety, increases confidence, and prepares them better for real intimate encounters. Understanding this variability is essential to avoid frustration and to maintain a positive perspective on sexual health in adulthood. To achieve the best results with Alprostadil, correct preparation and application are essential. Before starting, it is important for the hands to be clean and dry, since any residue can affect the absorption of the medication. You can imagine that you are preparing a delicate dish. The ingredients matter, but so does the cleanliness of the kitchen and the way you handle everything. In the same way, hygiene in the intimate area and on the hands ensures that the cream can act in the best possible way. The next step is to apply a small amount of cream, usually equal to the size of a grain of rice, directly into the urethra. Precision in the amount is essential. Applying too much can cause discomfort, while applying too little can make the effect insufficient. Some men find it useful to practice this application during calm moments, without pressure, to become familiar with the sensation and to observe how their body responds. This helps reduce anxiety and increases confidence before a real intimate encounter. The massage technique is another aspect that should not be underestimated. Gently massaging the area for a few seconds allows the Alprostadil to distribute correctly, helping absorption and strengthening the erection. It is important not to rush and not to apply excessive pressure, since softness ensures a more natural and comfortable effect. It is also recommended to prepare the environment so that the experience feels relaxing. A quiet setting with soft lighting, pleasant music, or any stimulus that encourages relaxation can make the difference between a successful result and a frustrating one. Another practical detail that many men overlook is the importance of emptying the bladder before applying the cream. Urinating beforehand helps the medication absorb better and reduces discomfort during the application. After applying it, it is recommended to avoid going to the bathroom for at least 30 minutes so the medication can do its job. These small gestures, even if they seem obvious, are part of a conscious and effective use of Alprostadil, and they are the foundation for regaining confidence and autonomy in intimacy. The effectiveness of Alprostadil does not depend solely on correct application of the medication, but also on the emotional connection and stimulation that accompany the intimate moment. Many men make the mistake of seeing the cream as only a physical remedy, forgetting that the mind plays an essential role in sexual response. This is why it is important to create a relaxed environment where communication with the partner is open and sincere. Talking about desires, expectations, and emotions before the encounter can create a climate of trust that enhances the effects of Alprostadil. Imagine a man who feels nervous before an encounter because he is afraid the cream will not work. If he manages to share his concerns with his partner, he can turn the situation into a moment of intimacy and complicity. Stimulation should not be only physical, but also verbal and emotional. Caresses, soft words, meaningful looks, and moments of connection before applying the product help prepare the body's response, making it easier for blood circulation to increase naturally and allowing a firmer and more sustained erection. Previous stimulation and relaxation also reduce anxiety and fears related to sexual performance. For example, some men find it useful to create small rituals before using the cream, such as a relaxing massage or sharing a moment of emotional closeness, so that the application is not seen as a mechanical act, but as an extension of shared intimacy. This approach not only strengthens the physical response, but also increases complicity and mutual pleasure, which is especially important in long-term relationships. In addition, emotional connection ensures that desire remains an active force during the sexual experience. Although Alprostadil improves circulation, excitement, and motivation are still necessary for an optimal result. This is why the combination of a good environment, constant communication with the partner, and attention to physical and emotional stimuli creates a synergistic effect that maximizes the benefits of the treatment. Male sexual health is not only a matter of body chemistry, but of complete care of the body, the mind, and the relationship with the partner. Alprostadil is a safe treatment when used following medical indications, but it is essential to know the precautions and possible side effects in order to avoid discomfort or unnecessary risks. Some men may experience mild irritation, a burning sensation, or redness in the area where it is applied. These effects are usually temporary and disappear on their own, but it is important to observe any persistent reaction and consult a healthcare professional if it extends or worsens. Each person's skin reacts differently, which means individual tolerance can vary. A common mistake is applying more than needed, thinking this will make the effect faster or stronger. This not only can cause discomfort, but it can also create hypersensitivity or tolerance in the skin. The general rule is to always use the smallest effective amount and respect the instructions on the packaging or those given by a health professional. Another relevant aspect is product authenticity. There are copies on the market that do not meet safety and quality standards, which is why it is vital to obtain Alprostadil from reliable pharmacies or with a prescription. Buying questionable products online can put health at risk and compromise the expected results. Men should also keep in mind that Alprostadil acts locally and does not have the same general effects as oral treatments. This means that in most cases, it does not affect the heart or interact significantly with other medications, making it an ideal option for those who take medication for blood pressure, diabetes, or cardiovascular issues. However, each case must be evaluated individually, and professional supervision is still essential, especially if there are chronic conditions or concurrent treatments. It is advisable to follow additional small care steps to maximize safety and comfort. Avoiding perfumed soaps or abrasive products before the application, drying the area well, and applying the cream gently helps reduce irritation and improves absorption. Keeping a routine of observing how the body responds also makes it possible to identify any adverse effect early and act cautiously. Safety in the use of Alprostadil is not limited to avoiding physical harm, but also involves the mental peace of knowing that a reliable product is being used responsibly, which contributes to a more positive and effective experience. The correct dose of Alprostadil is a key factor in achieving effective results and minimizing discomfort. The recommended amount is usually very small, similar to the size of a grain of rice, and applying more than indicated does not speed up the effects or guarantee a firmer erection. It can instead cause irritation or a burning sensation. This is why it is essential to follow the instructions on the packaging and, when in doubt, consult a healthcare professional to ensure that the dose fits each specific case and the characteristics of the body. The optimal moment for application is another decisive factor. It is recommended to apply Alprostadil between 5 and 15 minutes before the intimate encounter. This time window allows the substance to act properly inside the urethra and for blood circulation to increase naturally. Applying it too early can cause the erection to fade before beginning sexual activity, while applying it too late can create anxiety due to the lack of effect. This is why knowing the reaction times of your own body is essential, and it may require a bit of practice at the beginning to find the perfect moment. Recording experiences is also a very useful strategy. Keeping a small journal where the time of application, the amount used, physical sensations, and the level of arousal are noted allows patterns to be identified and results to improve progressively. This practice not only helps the man understand his physical response better, but also provides valuable information for a healthcare professional in case the dosage needs to be adjusted or combined with other treatments. The record can also include details about the environment, communication with the partner, and the relaxation techniques used, since all these factors directly influence the effectiveness of the treatment. Observing how each small change affects results makes it possible to develop a personalized routine that optimizes the body's response. This careful and conscious approach transforms the use of Alprostadil into an integral process where dosage, timing, and preparation combine to guarantee a safe, effective, and pleasurable experience. Practice is fundamental for Alprostadil to fulfill its purpose reliably and without generating anxiety. In the beginning, many men feel insecure and fear that the product will not work during the real sexual encounter. This is why dedicating a few moments to experimenting without pressure is key. It can be tested in a safe environment, alone, observing how the body responds, how long it takes to generate an erection, and what sensations appear. This familiarization helps reduce anxiety and builds confidence, because the man begins to understand his reaction times and the way the medication acts. Repeating the application consciously allows each experience to become a learning moment. For example, some men discover that applying the cream 5 minutes beforehand is too early and decide to adjust to 7 or 10 minutes. Others notice that small changes in posture or in mental relaxation significantly influence the firmness of the erection. Recording these observations in a journal can be very useful, noting both physical aspects and emotional state, as well as the level of connection with the partner. Practice also helps integrate relaxation and stimulation techniques. Trying massages, deep breathing, or moments of caresses before real intimacy can enhance the effects of Alprostadil. It is recommended to create a weekly routine where some encounters are dedicated to self-learning without performance pressure, which strengthens confidence and makes the first time with the partner after practice feel natural and satisfying. Repetition also helps build physical memory, so the brain and body learn to anticipate the expected response. This decreases performance anxiety and strengthens the feeling of control over the erection. Practicing regularly does not mean using the product every day in an obligatory manner, but rather using it strategically, observing the body's reactions and adjusting the amount, the timing, and the environment for each experience. This conscious training transforms the use of Alprostadil from a simple application into a complete process of self-knowledge and sexual confidence, contributing to an intimate life that is full and free of worries. Caring for male sexual health does not mean focusing only on a single treatment. Integrating Alprostadil with a broader approach to general health can increase its effects and contribute to overall well-being. Nutrition plays a fundamental role. Maintaining a balanced diet rich in fruits, vegetables, omega-3 and low in saturated fats improves blood circulation, which is essential for an effective erection. It is also recommended to stay properly hydrated and avoid excessive alcohol consumption because these habits directly affect bodily response and sensitivity. Regular exercise, especially activities that strengthen the pelvic floor and improve circulation, can increase the effectiveness of Alprostadil. Walking, swimming, or specific exercises such as Kegel help train the muscles responsible for maintaining erection and control. This integration between medication and healthy habits turns each application into part of a more complete process where science and self-care complement each other. In some cases, Alprostadil can be combined with hormonal adjustments under medical supervision if there is a testosterone deficit. This does not mean relying only on pills or injections, but observing how each intervention can strengthen results safely. For example, a man with high blood pressure and diabetes may benefit from a routine that combines Alprostadil, light cardiovascular exercise, and a controlled diet, ensuring that each element works in harmony to improve sexual function without risking general health. Integration also includes attention to mental health. Stress, anxiety, or lack of sleep can significantly affect response to the treatment. Establishing relaxation techniques, meditation, or even psychological support can improve the experience and strengthen connection with the partner. It is not only about optimizing the erection, but about creating an environment where intimacy is full, safe, and enjoyable. Every lifestyle component influences the effectiveness of Alprostadil, turning sexual care into a conscious and complete practice. Finally, the combination of therapies requires patience and observation. Not all men will respond the same way, and adjusting the approach according to individual results is essential. Recording habits, sensations, and progress allows both the patient and the healthcare professional to find the optimal combination, promoting safety, autonomy, and overall well-being. Integrating Alprostadil with general health is not a luxury, but a smart strategy for experiencing sexuality with confidence, pleasure, and responsibility at any age. One of the most appreciated benefits of Alprostadil is its rapid action. Unlike other treatments that require waiting hours or even days to notice any effect, this medication acts directly on blood flow in the penis, producing an erection within minutes. This characteristic not only increases the practical effectiveness of the treatment, but also helps reduce anxiety related to sexual performance, which is one of the most frequent causes of secondary erectile dysfunction. Many men feel more confident knowing they can depend on a quick and predictable effect, which transforms the intimate experience into something more natural and less stressful. In addition, applying the product locally means that the effects remain focused and do not influence other parts of the body, which reinforces the sense of control and autonomy. The confidence this generates is essential for psychological well-being because it allows men to experience intimacy without fear of unexpected failures. This autonomy is also reflected in the ability to choose the exact moment for sexual activity, adapting to personal needs and the rhythm of the partner, without depending on strict schedules or the slow response of other medications. Another important benefit is that Alprostadil can be used by men with chronic conditions such as diabetes or high blood pressure without interfering significantly with the medications they already take. This makes it a safe and reliable option within a broader health context. The possibility of combining it with other strategies, such as pelvic floor exercises or dietary changes, also allows the results to be enhanced and overall well-being to be maximized. Every improvement in circulation and sexual response contributes to a sense of vitality and personal satisfaction that goes beyond the sexual act itself, strengthening self-esteem and the connection with the partner. Real experiences shared by users show that using Alprostadil correctly not only improves erection, but also strengthens the relationship and emotional intimacy. The predictability of its effect reduces anxiety and makes communication easier, creating a more relaxed and positive environment. Some men even find that this tool allows them to explore new forms of sexual interaction, adding more foreplay and greater closeness with their partner. This extra benefit is not only physical, but also emotional, because the treatment helps reconnect with pleasure, desire, and personal confidence. In the end, the results are tangible and measurable, allowing each man to evaluate in a concrete way the effectiveness of the treatment and adjust habits and routines to maintain and improve the outcome. When Alprostadil is used with guidance, consistency, and responsibility, it becomes a powerful tool that not only fulfills its main purpose, but also provides confidence, satisfaction, and complete well-being, restoring autonomy in a fundamental aspect of adult life. Accepting the presence of erectile dysfunction does not represent weakness or a loss of masculinity. On the contrary, recognizing a difficulty and seeking solutions shows intelligence, self-care, and responsibility. Many men feel shame or fear at first, worried about how this may affect their relationship or self-esteem. It is important to understand that erectile dysfunction is a common medical condition, especially among adults and older men, and it does not define the value or virility of the person experiencing it. The psychological aspect is as important as the physical one. Performance anxiety and constant worry about maintaining an erection can worsen the situation, creating a cycle that makes intimacy difficult. For this reason, using tools like Alprostadil not only improves erectile function, but also helps reduce stress and tension. Every small success increases confidence and strengthens the feeling of control over the body and sexual life. It is helpful to remember that sexuality has no expiration date. Many men rediscover pleasure and intimacy with their partner even after years in a stable relationship. Open and honest communication becomes a fundamental ally. Explaining the situation to the partner, involving them in the process, and sharing expectations creates an atmosphere of support and understanding that enhances results and strengthens the bond. This allows the use of Alprostadil to integrate naturally and respectfully, avoiding tension or misunderstandings. Taking care of emotional health also has a direct impact on treatment effectiveness. Practicing relaxation techniques, breathing exercises, or mindfulness before sexual activity can improve physical response and the perception of pleasure. The mind-body connection is essential, and when it is combined with proper treatment, the results are usually more consistent and satisfying. Ultimately, the motivational idea is that every man should understand that looking for solutions and taking care of himself is not a sign of fragility, but one of maturity and self-respect. Taking the initiative to learn, practice responsibly, and maintain a positive attitude toward intimacy strengthens self-esteem, improves the relationship, and restores a sense of fullness and freedom in sexual life. The key is transforming worry into action, doubt into knowledge, and anxiety into confidence, because every step toward sexual health is a step toward a more complete and satisfying life. Reaching the end of this journey makes it essential to consolidate all the information in a clear and practical way. The first point to remember is that erectile dysfunction is a common condition that affects men at different stages of life, and that effective solutions such as Alprostadil exist. The key to a successful treatment is not only the medication itself, but also the integration of healthy habits, open communication with the partner, and attention to emotional well-being. Every step, from preparation to application, must be done carefully, following recommendations and maintaining a comfortable and relaxed environment. It is useful to create a clear routine. This includes preparing the private space where the treatment will be applied, ensuring hygiene and comfort, and choosing the most appropriate time of day according to individual needs. Recording each experience helps identify patterns of effectiveness and possible adjustments in dose or technique, making progressive and personalized improvement easier. Gradual and conscious repetition of the process increases confidence and reduces anxiety, which directly contributes to a more satisfying experience. Equally important is integrating general health habits. Maintaining a balanced diet, exercising regularly, and taking care of sleep naturally strengthens erectile function and enhances the effects of Alprostadil. It is also advisable to address emotional factors, since anxiety and stress can interfere with physical response. Combining medical treatment with relaxation or mindfulness practices creates a more complete and pleasant experience, reinforcing safety and autonomy in sexual life. Finally, this practical approach can be summarized as understanding the medication, preparing the environment, and following instructions carefully, communicating clearly with the partner, and taking care of physical and emotional health. This integrated way of acting not only improves erectile function, but also strengthens confidence, the relationship, and personal satisfaction. Regular check-ins with a professional ensure proper follow-up, prevent mistakes, and optimize results. Adopting these conscious habits turns each attempt into an opportunity for learning, security, and pleasure, ensuring that the experience with treatment remains positive and empowering. With this summary, the reader has a complete collection of knowledge, practical advice, and strategies to address erectile dysfunction safely, effectively, and with full confidence in the results. This reinforces the idea that every conscious action, every practice, and every moment of honest communication becomes a step toward a healthier, more satisfying, and fulfilling sexual life.